Alright, so the most common reason somebody sees me these days is for low back pain. It's actually the most common reason why somebody sees a doctor, whether it's their primary care, go to the ER, urgent care, or to come and see us. And it can come from all sorts of reasons why somebody has low back pain. But the most common reasons why somebody has low back pain is typically due to strain to one of their muscles or ligaments in their back. Could be from arthritis, and we're seeing a lot more of that as we live longer, more active lives. We definitely see more and more of arthritis pain. There are folks that generally can get a typical lumbar disc herniation that then impinges on a nerve, and that can cause pain. I would say those are the three most common reasons why somebody comes in and see a physician for their back pain. When somebody comes in for their low back pain, we typically perform a history and physical exam. We ask them what they're feeling, what prompts the pain, and by hearing their story, we can usually get a good idea of why they have pain, whether it's that muscle strain, that disc herniation, or from arthritis. Now, it won't be 100% completely accurate, but we will have a general idea of why they have pain. After that, we'll then likely order some imaging to help further diagnose their issue. If you're experiencing pain that is excruciating, lasting for quite some time, despite conservative therapy with rest, medications, and they become even worse, I think that those are good signs for when you should go see a doctor. If you start experiencing pain that is now tingling down your leg, weakness in your leg, or even severe enough where you're having incontinence, that's when you really should see a professional. All right, so people experience pain for all different types of reasons, and really when I see somebody who has pain, it's really trying to determine why they have pain. Is it due to lifestyle? Is it due to things that they can control? If they are, then we work on those things. If they are things that they don't have control over, they've already done everything that they can, then we start potentially doing some things like interventions or injections, procedures that they normally would not have considered. But it all comes down to why do they have pain. And so that's my approach for every single patient that comes through the door. Try to figure out why they have pain before we jump to any major decisions on how to treat that pain. So if somebody still has persistent low back pain, despite resting, despite physical therapy, despite medications, and we want to further evaluate why they still have that pain, that's when imaging comes into play. We'll start with x-rays. We may end up getting an MRI, a CT scan if an MRI is contraindicated, and take it from there. So when somebody first comes in to see us for low back pain and they haven't attempted any type of treatments just yet, we would start very conservatively with exercises and stretches. We may have them see a physical therapist to have somebody work with them on a routine basis 2 to 3 times a week, and they will likely also have some homework for them to perform at home. We will also likely start with some oral medications, and if those treatments don't provide the results that we want, then we'll talk about some further options. So when somebody comes in with low back pain, there may be a number of reasons why they have that pain. Part of that could be how they're taking care of themselves. Is it posture? Is it due to having a weak core? Those things will be evaluated, And as we identify those issues, we'll work on strengthening their core. We'll talk about what they're eating. We'll talk about getting enough rest. Is it their posture? Is there something that could be causing a mechanical issue in their low back? So those are some things that we will address in your visit with us. So there are times when somebody will come in and they have low back pain that then radiates into one of their lower extremities or both extremities, into the buttocks, into the thigh, into the leg, and maybe even down to the foot and toes. That usually indicates that somebody has an inflamed or irritated nerve in their low back. We'll order an MRI, and usually the MRI will reveal that that nerve could be getting irritated. So what do we do about it? If they've tried conservative therapy with medications, rest, physical therapy, and that still doesn't resolve the issue, we'll likely utilize something called an epidural steroid injection. Basically, we would take a strong anti-inflammatory medication like steroids, and we deposit it directly onto that inflamed and irritated nerve. Hopefully, by putting the medication there, we can reduce the inflammation and irritation, and if we can reduce that, then usually the pain will also improve. So there are times when somebody comes in and they have pain due to a nerve that's irritated outside of the spine. A common one that we see are folks that come in with hand pain. Most commonly it's carpal tunnel syndrome, where they wake up in the mornings and their hand becomes really numb. They'll have like a burning sensation. They may even drop things. And it's usually due to a nerve. It's called the median nerve. It runs right through here and it's getting irritated. So we'll perform a carpal tunnel injection, basically putting some medication right onto the median nerve, and hopefully that will reduce the inflammation, and now they have reduced pain and improvement in function of their hand again. When somebody comes in for low back pain, one of the most common reasons for somebody to have low back pain is due to arthritis in their spine. Right now, one of the first-line treatments for that pain, if conservative therapy has not provided them significant relief, is radiofrequency ablation. There are tiny little nerves next to the joints of your spine that we can put to sleep by using heat. And if we heat those nerves, they typically will put those nerves to sleep for about 6 to 12 months. So somebody who has arthritis pain in their low back or neck, we can go ahead and perform radiofrequency ablation and put those nerves to sleep, and they can be pain-free for up to a year, sometimes even longer. But on average, it's about 6 to 12 months. When somebody still has persistent low back pain or low back pain that runs down the leg despite a surgery, despite multiple minimally invasive procedures, it's usually due to a nerve that's still sending signals to the brain because it's inflamed or there's a permanent injury to that nerve. So that's when we utilize a medical device called a spinal cord stimulator. It is a generator hooked up to two little wires that sit close to your spinal cord. What it does is, by sending out electrical impulses, it will try to disrupt that signal going from the nerve up your spinal cord into your brain. If we can disrupt that signal, hopefully your brain doesn't pick up that pain signal coming from the nerve, and now you experience a significant decrease in your back pain. When somebody comes in for persistent low back pain due to a compression fracture to one of the bones of their spine, and they've not been responding to conservative treatments, we'll then look at the spine again with an updated MRI. If the updated MRI reveals that that bone is still really soft and it looks like it's still going to be compressed further, we want to consider a treatment called a kyphoplasty. Basically, we go in and we want to harden that bone so that it will stop being compressed. Usually that will provide them with significant pain relief after the procedure is completed. So sometimes there are patients that eventually will need an intervention or minimally invasive procedure to help with their pain. And that can be very scary for somebody who's never had one of those procedures done before. Generally, what I found to be effective at putting somebody at ease is utilizing humor. Plenty of times folks have asked me, have I done this before, or how have patients responded? And I always hit back with them saying, hey, I just watched this on YouTube yesterday. I've already done 2 today, and they worked out fine. So that, using things like that can generally help to put somebody at ease, especially if they're not getting a procedure with sedation. Now, there are times that we can do procedures with sedation, and that is another avenue that we can take to help somebody with anxiety before their procedure. So if you're still experiencing pain, whether it's in the neck, low back, in a joint, or any other part of your body, we'll be more than happy to take a look at you. Feel free to reach out to us. We'll answer your questions and hopefully come up with a treatment plan that will help to reduce your pain.